All right, everyone. So we're going to go ahead and get started. Good morning, and thank you for joining us. So I recognize a lot of names, but in case you don't know me, my name is Ruth Jones. I am the Policy and Governance Manager at the Alameda County Office of Education. And I work very closely with Lisa Erickson and Michelle Smith McDonald and also Eric Sarb to plan our COVID liaison check-ins that we are now holding monthly. So we're going to hop right in because the goal is to make sure we have as much time for Q&A as possible. If you have not already accessed it in the chat, you will find the agenda. On the agenda, you will find a link to the presentation that we will use for today. And you will also find a link to, or excuse me, you'll find links to a lot of the resources that we are discussing today. So with that in mind, we're going to go ahead and get started. And I'm actually going to point your attention to the agenda to let you know that we have a resources section, but we also have, and let me share my screen. We also have a link for the CDPH Outbreak Response Team's mobile testing and vaccination services. We are not going to go over this with you today, but this is a resource for you to look over. This is a resource coming from the state, but they are working with the local public health agencies. Should your district or your school experience an outbreak, they are here to support you, to come out and support with testing. And so take a look at this flyer, and if you have any questions about it, feel free to reach out to me, but this is a resource that is available to you. With that, I'm going to go ahead and pass it off to Michelle Smith McDonald so that she can talk to you all about our guidance document.
Hey, good morning, everybody. Nice to see everybody. Many people I saw we see yesterday, and we see them again today. So happy 2 days in a row, and thank you for being here. So based on some of the feedback that we received through the feedback form that we created for the all schools meeting, there was a request for information about just a quick walkthrough once again of the guidance document. So some of the folks on the call may not need this, but I'm going to call up our guidance document really quick because I want to make sure that people are aware of how to find things and where to find things in the guidance document. So give me a moment while I share screen. This is going to be should be hopefully a familiar document to everybody on this call, as this is the document that we use to literally guide the work that we're doing. So let me share. Okay. All right, we are sharing screen. Okay, so this is our Alameda County School Guidance document. It is updated regularly. The last updates took place this week, so you can tell when it's been updated by the date that's down in the lower portion of the main page. And so as you walk through, you have your table of contents where the teal stars indicate new content. So this document is updated usually at least once a week, sometimes more often, but new content is located with the teal stars. On our first page, we have our federal guidance. This is CDC. This is overall CDC national guidance, as well as U.S. Department of Education. I will, just for general principle, we do work on this page a little bit less than some of our others, but it is, and so the principle behind this document is that things are direct links to where the information is that you are in need of. So we're going to go to the second page, which is our state guidance, which is a page that we use quite frequently. Obviously, state guidance for reopening schools, the Safe Schools for All hub, in addition to CDPH documents, so the school guidance document for CDPH, face coverings guidance, K-12 testing, vaccine verification for workers in schools. And then we've got some additional guidance. So we have school guidance FAQ, which the state updates, and there are some updates in the FAQ this week. We have on this this margin here, on the left margin, we have Cal OSHA information that applies to your employees. We have outbreak response team information, vaccine, ventilation, Q&A as well. We move to our local guidance. And so our local guidance, we have our Alameda County health orders, which are updated, the health orders from the city of Berkeley. And then in addition, we have a large section of positive case reporting, symptom and protocol testing. In addition, in the margin, we also have the COVID-19 retesting tips, which is a document that we wanted to link to this area that's associated with testing to make it easy to find. Some of these things are located in more than one place, but we wanted to make sure that they're in places that make sense based on what information you're seeking. The next page that we have is all vaccine. So we have the vaccine, I'll start in the margin with the vaccine mandate overview, which is new information from last week based on the governor's vaccine mandate, and then any and all vaccination related resources. Our additional guidance section is for the guidance that applies to specific areas. So obviously across the top, we've got travel, childcare, and air quality guidance. And then we've added the holiday guidance section at the bottom. In between is a substantial amount of our youth sports and extracurricular guidance, including any FAQs or any guidance related to those topics. We move into our last couple of pages. So the page 8 is primarily ACPHD handouts, information that is usable for your parents and your communities. And we recommend that if you have these specific circumstances happening, that you share these documents. They were created to be shared with communities. We have K-12 testing scenarios and then handouts on any number of topics. Then we have our show up for school resources, which are generated by ACOE. And those are also parent-friendly resources on everything from immunization to free meals to changes to independent study. But these are more directly related to school education and curriculum, and the ACPHD handouts are more related to the protocols you all are employing directly related to COVID. As we move through, folks will see that we have added some FAQs. The reason that we added the FAQs after not having them for a long time was that we knew there were some gaps to be filled between what the state guidance was and information that you all were receiving. And so our attempt to do that was to fill in with some FAQs based on questions we've seen in our meetings, questions we've picked on parent town halls, but just making sure that any questions would fill the gap and they are sorted by subject area. Including some definitions of the term. Let's go back really quickly because we get a lot of questions. Obviously, the definitions of the terms isolation and quarantine. And then we're moving through modified quarantine, FAQs. Again, these are gap filling. They're not meant to be comprehensive. The comprehensive documents and the information are located in those links on other pages. These are meant to fill gaps and answer commonly asked questions that we've been getting. So that takes us through our guidance document. So we hope that it's easy to use. We hope you're finding what you need. And I'm happy to take any feedback about things that you find are difficult to find or that you're having trouble locating, because again, this is a really iterative document and we're working really hard to make sure it works for you because that is the intent. So I'm going to stop sharing and I'm going to send this back over, but that is the walkthrough of the guidance document.
Thank you, Michelle. Okay, so before I pass it on to our partners at Public Health, just want to remind you, especially for those of you who are just joining, I put the agenda in the chat. On the agenda, you will find a link to the presentation that we'll be using momentarily. You'll also find links to the resources and documents, including the guidance document that Michelle just talked about, linked in the agenda. Okay, so as we go into this next part, we ask that if you have questions, go ahead and put them in the chat. So we have our ACOE staff, Eric Sarb. He's going to grab the questions from the chat and he's actually going to put them at the bottom of the agenda so we can all follow along with which questions are being asked. So again, please go ahead and drop those in the chat. So we are going to move on to testing documents. I'm going to share my screen so that I can run the slide deck for Lisa Erickson. And with that, Lisa, I am going to pass it to you.
Sorry, it took me a minute to unmute. Friday morning, I guess.
Lisa,
good morning, everybody.
Hey, Lisa, there's a question in the chat from Kelly French that relates to communication directly. And since that's my area and I'm going to be sort of in and out here while doing some other things, I wanted to just sort of take that on really quickly, if that's okay. So Kelly French, Kelly's asking, teachers and coaches are frustrated that they're kept out of the loop when it comes to symptoms, exposures, and positive cases. Students disappear, reappear. Suggestions to improve communications with staff members outside of the team. Well, communicate with them. We have talked in this COVID liaison meetings all along about how closely you're going to have to work with other departments and other people that are related to this work. Many of our districts have communications departments. I know Kelly in Pleasanton, you've got a couple of folks in communication. Anything that they can create, any systems that they can assist with, communication with principals and making sure they're in the loop. But my suggestion to improve communication is make sure that you have perhaps a workflow or a checklist of people that need to be communicated with about things that are coming up. And I realize that adds to the workload, but if you can designate somebody to do that work, to make sure that you're checking off your boxes of communication, or to enlist your communications folks to help you create a workflow for making sure that people are communicating about, well, you're talking specifically when it comes to confidentiality. I'm stopping here because I'm trying to figure out, not everybody's going to get to know everything. So we'll start with that. If you have cases, you can say, I have to think on that one. I mean, what I want to tell you all is make sure that you're communicative, make sure that your coaches and your teachers and people understand you have students out. You may not be able to give up they're going to know who's out. That's the other part of it. They're going to know who's not with them. And so you may have to figure out a way to communicate on status. I may have to double back on this and see if I can provide some more support here for your communications folks and whatever, but this is one of those things. There are things in this process that are difficult. There are things in this process that are not going to make people happy because this is a difficult process. And so I will ponder on that, and maybe we'll have to loop back around on that, and I'll see what kind of suggestions I can come up with. It is very challenging, and it may just be challenging. There may not be answers for everything. So there are lots of things in the chat. So people are finding a challenge around this issue. I will do my best to try and pull some things together and see if I can be of assistance here. I don't want to start firing off answers except to acknowledge that I understand the challenge you're facing, and I will see what I can do to help. And I don't know off the top of my head how to address some of this, so I will have to work on that.
Thank you, Michelle. And thank you for the questions in the chat. You can continue putting them in there. And after Lisa goes over a few pieces of information, then we will get to answering those questions that came in the chat. All right, Lisa.
Okay, great. Thank you for that, Michelle. I'm also happy to help think through that issue as well, because that has come up on our line and around confidentiality, and it's tricky. So we'll definitely keep you all posted on what we find out around that. So we don't have a real formal presentation on lots of updates today, but I did want to go over a couple of documents with you all. I know you all know that these documents are out there, but just wanting to kind of reiterate and maybe walk through them a bit so that you know what's in here. And then we can pretty quickly open things up for questions today. So the first one is the summary of K-12 testing scenarios. I just wanted to kind of review what's in this document. This was recently updated. The date will now say 10/14. I got that updated last night, and it'll be posted by the end of the day. So you'll see an updated document on our website as well as on ACOE's website with the correct date. But just to let you all know what's in this document. So this provides scenarios that have been coming up, and most of the questions that we get are around these scenarios. The first one is around screening testing. So it tells you what kinds of tests you can use for screening testing, asymptomatic screening testing, and what kind of confirmatory test is needed, and if you're able to do at-home testing. So those are the main categories, and then the scenarios are on the left. Screening testing is the first one, diagnostic testing for symptomatic students, and then it talks about modified quarantine and shortened quarantine. So these are the scenarios here. Hopefully this resource is useful. I use it all the time because it's hard for me to, memorize all this information. So, and I want to make sure that I'm always providing accurate guidance. So I kind of have it up on my computer all the time, and I'm always referring to it. So that's one. And then I just also wanted to introduce Dr. Locke. Dr. Locke, I don't know if you can come off mute. But Dr. Locke is very, very helpful in helping us answer all of these very clinical test questions around testing. And, so feel free to chime in, Dr. Locke, around anything that I'm presenting here. And I think today she's going to be available to answer your questions too, if you have ones that we aren't able to answer. It looks like Dr. Locke can't unmute.
Try one more time, Dr. Locke. I just checked that setting. And
there we go.
Thank you. Hi, Joanna. Joanna, do you want to mention anything else about this document before we go to the next one?
No, I think the main changes were around replacing Q with point of care NAT, because I think the Q is not so much in play anymore, and then changing some of the language around confirmatory testing and when it is and isn't needed. And I don't know if you've mentioned this already, Lisa, but the state is analyzing its data on antigen testing, and there will be a decision, or say a recommendation from them at some point over the next week about whether antigen tests can be used to clear symptomatic students, which right now, as you know, they're not permitted. And then they're also taking a deeper look at home antigen testing too. So there will probably be more updates to this document next week. And we will make sure we change the date this time.
Ruth, maybe should we see if there's any questions in the chat specific to this? It looks like there might be, and maybe
There is.
or should we wait until the end of the testing? What do you think?
Well, this one is specific to the document, and it may be a quick answer. So
Great.
the question from Annie Martin, it says, can you clarify what the improving symptoms part means? I believe she's talking about this
right
one.
there.
Mhm.
Yeah, so if a student let's say a student has a fever and a cough and a runny nose, they have to be fever free for 24 hours without the use of fever reducers. But they also should be feeling better. Like if the student has a hacking cough and there's snot pouring out of their nose, they probably shouldn't be back in school, especially since it's really hard to have those symptoms wearing a mask. So you want the student to be like on the mend rather than like deep in their illness. And I know that that's still vague, but really do think about, we need kids to be masked at school, because that's a key part of our safety layers. And there are certain things that make it hard. If you have a bad runny nose, you soak your mask really quickly. So, given the masking, you might think about when it's logical for kids to return to school slightly differently than you would have normally. That probably didn't help, because I don't have a hard and fast rule for you.
So Anna, if you have a follow-up question, go ahead and drop it in the chat. And then if we need to circle back around to it, we can. So Lisa, if there's nothing else on this one, I don't see any other questions specific to this document. So are you ready?
Okay, I do want to address Anna's follow-up question, because I think probably a lot of people have this question, if that makes sense. It's kind of a
I was just answering that
all the time. Okay,
that's correct. So students had a negative test, and obviously that's a point of care NAT, like a Q, or a PCR. So we're still not using antigen in that way. Then yes, they don't have to have. If they've already tested negative, they don't have to get tested again, unless they develop new symptoms, right?
Thank you, Joanna. Great. So, and we'll continue to update this document. If the state adjusts their guidance, we'll let you know when we make those updates. All right, so the next document I wanted to walk through is the COVID-19 retesting tips. So the audience for this document is families. It's still kind of complicated. I mean, still a little confusing, I think, just because testing is confusing, but we did our best to try to make it as clear as possible for families, and we are getting this document translated. So hopefully I can get an update on that translation and where we are with that sometime today. And one of the main reasons why we developed this resource is that so many families, we were getting so many questions about retesting, and so many families were going out and getting retesting when they didn't really need to, or actually shouldn't be getting retested. So the first question here or situation is, my child just tested positive at school, but I want to get them retested because they don't have symptoms. And so we walk through, different situations and when they might need to be retested or when they should not be retested. I don't know, Joanna, I don't think we need to walk through every situation, but the goal of this is just to show you that this resource is here and that, you can show it to your families if they have questions about retesting. It's kind of like backup for you too. As you're giving information to families, use this resource. That 48 hours, maybe I can walk through like the first, or Joanna, do you want to come off and?
Yeah, I mean, this may change depending on what the state does. So
Yeah.
I don't know if you want to hold translation for another
Oh, that's a
week
good point.
until we
I didn't even
see
think of
what
that.
happens.
That's a
But I
good point.
also want to make the point that the state sort of sets the floor.
Mhm.
You don't have to, if you want to stick with, PCR or point of care NAT for clearance tested for symptomatic kids, you can do that and we will back you up. You don't have, just because the state says you can use antigen tests in that way does not mean that you have to use antigen tests in that way. So I just want to make it clear that the state is like the minimum, right? And then you can always do more depending on the comfort level of you and your community.
Thank you, Joanna. Maybe the one situation I will kind of point out here that does seem to come up quite often. Ruth, can you just scroll so I can see the top of the document? Thank you. Let's see. So a child without symptoms or known exposure, so they don't have any, they're not quarantining, they haven't been exposed to anyone with COVID, has a positive antigen test. The question is, should they be retested using a PCR, or they should be retested using a PCR? But the thing I wanted to point out is within 48 hours. So sometimes we do get questions when a PCR is delayed, past that 48 hours, and that might be a different situation. You might actually go with the antigen test. Joanna,
and we're talking about the collection date. Obviously, you're going to get it back longer than 48 hours. So if you have a student with a positive antigen on a Monday, and then they don't go and get their PCR test until Thursday, and then they get negative results back on Saturday, we go with that original antigen. If parents want to get retested, and everybody does, because no one wants a positive test result, like they need to do it right then.
Thank you. And I think that's probably it. Mainly, and maybe another point to point out is that if a student has a positive PCR test, it's not parents shouldn't go and seek more PCR tests. So that's another thing that this document is trying to discourage, so that, then they're comparing all the different PCR tests where you're always going to go with that initial PCR test. So not to go what some counties call fishing for PCRs. Okay. And then this is the last bit of guidance I wanted to just walk
I'm
you
sorry,
through.
Lisa, I actually have the exposure letter next. And it didn't
okay, great.
go
That's
quickly
great.
enough. So Jamie.
Thank you. You can take her off mute.
She should be able to come off.
Yeah.
Okay. And then Jamie, do you need to share your screen? I can't, right? Can you do that?
Yeah. So
Okay.
Hi, everyone. I'm Jamie Harris. I think I've met most of you in this setting or other settings before. I work with Lisa at the health department. So I'm going to share with you guys today. I may have too many things up on my screen. We have revised the close contact letters. So I just let's see. I want to first of all thank New Haven Unified. They adapted the old template and we adapted their template. So we have 3 versions. Let's see if I can do it this way.
Jamie, can I just provide one little minute of just a second of context before you jump in?
Sure.
So
great.
To remind everybody, these exposure letters right now are part of our longer guidance document. And so we're updating just a section of that. And we're probably going to format this and have it be a separate document that will eventually be part of the guidance. These just got finalized yesterday. Also want to mention that a lot of you already have exposure letters, which is great. This is really for, if you guys want to just take some tips from these or, they're samples. So use them. We've all been working with districts on updating their exposure letters throughout the last few weeks, but this is just kind of a, an update that we probably should have done like a month ago. So,
Yeah.
but
Yeah.
here we are.
Thank you, Lisa. Yeah, and it's
Sure.
really, it's just an offering. This is not a
Yeah.
required template, right? It's just an updated starting point. Or as Lisa said, you can pull pieces of it in with your existing letters. So what we have are 3 different letters. One, depending on what your quarantine options are. So one is if you're just doing the 10-day quarantine, that is the simplest, right? You probably may not even need to update it. There is the, if you're doing 10-day and shortened quarantine, and then there is the letter if you are using modified quarantine. So that's the one I'm going to show you because it has blurbs. It has a blurb about each of the types of quarantine. And then, but there is a separate letter for each combination. So obviously you'll put your own logo on it. This is going to get formatted. The red is what you fill in. I would suggest if you end up adapting this, you may want to take that out of red so that you don't have to do it every single time. But for now, we wanted to make it really clear. So the main changes are a couple of things, right? So there's the hello, your child's been exposed. You've got up front first here is the guidance for fully vaccinated folks, right? Saying that you don't have to quarantine, but you have to monitor. And here's the symptom monitoring. And here's where you add in the date for the full 14 days they have to monitor for. There are links in this document, which of course only work if it's an email, but there are links to guidance along the way. So here you have a link to the CDC's symptom list, right? Just as for more reference. So if your student is not fully vaccinated, this again is the full quarantine options. So we start with modified. This is if as a school you are using modified quarantine, right? So you say that up front, we're using the modified quarantine. Your child can continue to come to school. We have put this phrase in here. You may want to change it based on your protocol, but what we said is if you want your child to quarantine at home instead of doing the modified quarantine, please contact this person at this number as soon as possible, so that the school is aware and that you can support them at home, right? So this is written with the assumption that you're using modified quarantine, that people will do that. That they can come to school as long as they're meet the requirements. But if the parent wants the child to quarantine at home for some reason, you have that caveat here and they can notify you. So option 1, modified quarantine. This link takes you to the flipbook page around modified and shortened quarantine, and it just lays it out. Your child must stay home except for attending school. They can continue to come to school for in-person instruction. You guys all know this. If they have no symptoms, they continue to wear their mask, get tested twice a week. This is where you would fill in if you're going to be providing the testing at school, and if so, you would provide the relevant information, right? There are links down below where you add in the rest of the testing info. They continue to quarantine outside of school, and if they develop symptoms, they keep them home, isolate immediately, let the school know. And then what we've added, really, which is if you take nothing else, you may want to think about if you don't already have a chart like this, is to make it really explicit for people what the dates are, right? So there's no guessing. So for modified quarantine, so the red again is what you're filling in. Here was the date of exposure, that's day 0. Here is when the negative test needs to happen, today or tomorrow, right? It's ASAP. When would be the first, the test 3 days later, and then when they exit from quarantine. Same thing then with shortened quarantine. It just explains that your child must stay home for 7 days. If they do not have symptoms and they get a negative test on day 5, they can come back to school on day 8. So this is the kind of narrative explanation. And then here is just the nitty gritty. Here's the day they were exposed. Here's the day you can test between this date and this date. Here's when they can come back to school. Right. So really it's this, when do you test and when can they come back to school, or what we're trying to make very, very clear and upfront for people. Then option 3, you have the standard 10-day quarantine. Again, there's a link to the instructions, and they stay home for 10 days. And here's the 2 dates. This is when they were exposed, and this is the date they can come back. And then there's a little bit more about all the quarantines, right? The self-monitoring, following the interventions, what to do if they develop symptoms. A little bit more here about what happens if your child needs urgent care. And then a little piece in here around the high risk folks, right? And then this is additional stuff that's important. So we have testing information here, so everyone can get tested at no cost. This is for you to fill in if you are doing testing on site at your schools, and you would want to put that in here first. If you have other testing sites in your community and say on your website, you have a link to where all of your testing sites are, you would add that link, and then we already preloaded the ACPHD testing link. We have also added in the direct link to the community resources page. So there's both the website link and there's also the QR code. So if this is a paper letter going home, somebody can scan the QR code. This takes you directly to the community resources page on our public health website. So it has the link to all of the resources. And then there is also a link if you want to get a vaccine, sign up for the vaccine after quarantine is over, you go to this site. So we're linking them to testing, to resources and vaccine. You want to provide your contact information, and that's it. So this is the most extensive. The other two letters, if you imagine, you just has just the pieces that are relevant. So again, there's one that has no mention of modified quarantine. It's just the instructions for shortened and standard. And then there's one that's just the instructions for standard. So should
Jamie,
I look in?
I'm gonna hop in here. I'm just gonna hop in here and I'm gonna reiterate that these templates, as soon as they are finalized, will be added to the guidance document. And I will put them on their own separate space so that they will be abundantly clear that these are templates. We will label the 3 templates so that you all know the difference between the 3 of them, and you'll pull them. Today, right today, they're not available. As soon as they are ready, we will add them to the guidance document. And then hopefully by, a couple of days into next week, they will be in the guidance document, and then they'll be easily labeled and everybody will be able to use them. But as of right at this moment, the letters are not available. We're working on finalizing. We're trying to show you things that we're going to have, that we have available and resources that we're building for you, but we need a little bit of time to add them. So we will make sure that they end up on the guidance document by early to mid next week. They will be in there, I promise you, before Thursday's next all schools call, so you all will have access to them.
And thank you so much, Michelle. I'm scanning through the chat. I want to point out, someone said we like to also let them know when they can be released from quarantine isolation as well, so they know if they can go outside their home on a weekend. So I'm assuming that's a reinforcement that it's nice to have this exit date, right? And notice even for the modified quarantine, it does show when they can exit the modified quarantine for all other things. There's also what feels almost like a rhetorical question from Anna about recommendations responding to a parent who's very angry that this is even an option. There, I think you did exactly what you can do, which is that the parent always has the option to keep their child home instead of doing modified quarantine if it doesn't feel safe to them, or for whatever other reason. And beyond that, I mean, you can always send her to the public health department if you want, if she wants to yell at one of us over here. But the data on modified quarantine is showing that very, very, very few students who are exposed and do modified quarantine end up becoming sick. So, but I think that's one of those you just have to reiterate what you did, which is that it's parent choice. They can choose to keep their child home. So I don't think there are any other questions. You guys can play with this. Again, it's just an offering. Hopefully we've tried to just scale it down and make it clearer, right? Put things in the little grid, highlight certain things. We all know that people still need help walking through it, but hopefully this is a little bit better of at least a template. So take what you can from it if anything is useful. If you have other suggestions that you think would be beneficial to others that we would add to a future template, let us know as well. And I think that's it. Okay, we'll leave, I guess, questions for afterwards. Anything else?
We have a couple more things, Lisa, that you need to go through, and I know we have a lot of questions.
Yeah, let's go ahead and do that. I'm just going to do a really quick walkthrough of the Halloween guidance, and then let's go to questions, because I think there's lots of testing questions that have been answered in the chat that we should probably call out.
And I think Joanna has her hand up, though. Do you want to?
Oh, Joanna, did you want to jump in?
There's just a couple of points I wanted to make, but Lisa, if you want to finish the Halloween guidance.
Okay, thanks.
First.
Okay, I just want to it'll take, 30 seconds. Thank you, Jamie, for presenting those.
Can you all see my screen?
No.
Okay, let's try this one more time. Apologies. Okay, Okay, can you see it now?
Yes.
Okay.
Okay, so just real quick, wanted you all to know that this is our Halloween and Dia de los Muertos guidance. Again, most of this in here are recommendations, not requirements, but take a look. And as Michelle mentioned, all of these kinds of guidance documents in the future will be under the holiday section in the ACOE guidance. So you can see, what categories are in here. So just wanted to let you know to take a look. I also, while we're on this topic of kind of events and, dances and things like that, wanted to also remind you, I mentioned this yesterday on the all schools call, that the state also put in their FAQ a little more information about when you want to have, events on your school campus, of things to keep in mind as well. So these are kind of two resources you can use for that. I think it's number 20 in the state FAQ. And then here's this Halloween guidance as well in Dia de los Muertos. And I think that's it. And Joanna, off to you for your hands raised, and then we can get into the chat and answer some questions.
Someone may have said all of this already. I apologize if I missed it, but I wanted to make a couple of points about modified quarantine. One is that we have codified in our quarantine health officer order that if a school chooses to allow modified quarantine, you have to follow the rules in the state guidance, because I know we had heard some things around sort of schools letting kids stay in school but not testing. If modified quarantine is a great option, if you choose to implement it, you also have to implement the testing. To not do that would be in direct conflict with our legal health officer order. So I just wanted to make that point. The other point is, and I think this is reflected in the letter, there's really no, MQ is sort of presented as this sort of 10-day option, but really quarantine now is a 7-day with testing option. If you offer modified quarantine, you want to test, right after you find out, and then day 5 or later. And if the second test is day 5 or later, students can return on day 8. No matter when you get the second test back, you can't return before day 8. You can't have a 6-day quarantine. 7 days is the absolute shortest time. You can either do that at home, you can do it at school. If you do it at home, you just need the one test day 5 or later. If you do it at school, you should be tested twice, but obviously with weekends, sometimes you only get one test. But one test needs to be day 5 or later. And then the other thing I wanted to mention is we get a lot of questions about ongoing exposure. So let's say, a student's sibling tests positive for COVID. The way that it is currently, the way the rules are currently designed in both our isolation and quarantine orders is, so this is obviously for unvaccinated students. The day 0 of a student's quarantine is their sibling's last day of isolation. So a student in that circumstance has to stay home because they have an ongoing home exposure. I think there's rare cases, depending on the house, that the infected student can really be isolated. So they go in their room, maybe they have their own bathroom and they never come out for 10 days. But I think it is very hard for parents to separate their kids in that way. Most people don't have that kind of space. So you have to assume that the siblings are kind of for that whole 10-day period, they're being exposed. So day 0 of the quarantine period is day 10 of the student's isolation. And then they have to do another 7 days with tests. So it's a long time for those siblings to be out of school. And I know that that's very hard on families. But that is sort of the current guidance. I know there's conversations about whether it makes sense to shorten that period, given some people feel like if you're going to get infected, like you'll get infected before that. So maybe that's too long, but that's currently the guidance that we need to follow. And if there comes a point when we can alter that, we'll definitely let you know, because I really do appreciate, that's, 2 full weeks, at least 2.5 weeks of a student having to be kept home. So hopefully that made sense. If not, let me know.
All right, we're going to hop right into the questions that have not yet been addressed. So starting on, this is under the communications category from Anna Martin. How quickly will we get a response if we try to request support from the outbreak response team? Public health, do you all know, in order for them to get access to the state, the CDPH outbreak response team, it says in the flyer that they need to actually reach out to the outbreak response team at the local health jurisdiction. So do any of you have an answer on just how quickly a response will be given should one of our districts reach out?
Ruth, can you pull up I just want to make sure I'm answering this question correctly. And then I don't know if Alicia is on the call. Alicia, are you here? Because Alicia works with our outbreaks team, and it would be great to have her answer this question if she's on the call.
Yeah, I'm here.
Great,
It'd be
thanks,
great
Alicia.
if I had an answer to that question.
Yeah.
I haven't, and I think they're maybe opening it a little more broadly now for schools. I think this is kind of the first I'm hearing about it as being really an option for schools. So I'm not
Ruth,
sure.
Sorry, really quick, Alicia, I was thinking, Ruth, that flyer, if you could share that, because then we could just see what the language says in there around reaching out to the local health department. Is that what
Can
you're
you see
talking
my
about?
screen?
Yeah.
Oh,
Well, it's coming.
Okay. So
Sorry.
right here it says how to
Thank you.
request.
Thank you.
Mhm.
What was the original question? I was thinking, I thought I heard it was about the timing. Is that right?
So the question is,
Sorry.
it's okay. How quickly will we get a
Yeah.
response if we try to request support from the outbreak response?
So that's directly from the state also.
And so the state is saying schools should
Yeah.
first reach out to their local health
Right.
jurisdiction if they believe they need support.
Yeah.
So would it be possible?
This is a good question. I realize now I haven't thought too much about this and I'm not sure exactly. So we would submit it to MOAC. So I think it could happen very quickly if once it comes to us, but then I would say at least 48 hours probably, but they may prioritize this type of request just because of the timeliness of it. So I think the best answer for this is that we need to look into it a little bit and somehow get an answer back to all of you, because I really don't have a great answer for that right now.
Thanks,
Sorry.
Alicia.
Yeah.
Thank you. All right, so moving on to the next question, coming from Kathy McCall. And this is about confidentiality, so we may not have an answer. I just want to lead with that. The student is absent and we or the parent asks the homeroom teacher for work for a student for a few days. It would be obvious that the student is in quarantine. Is that okay to do? So Kathy, are you asking, is it okay to ask for the work for the student? If you could come off of mute just to clarify that. And everyone should be able to come off mute. Okay. Kathy, are you able to clarify that question for us? Oh, her mic isn't working. Okay, Kathy, can you put it in the chat and then I'll circle back around to this question. All right, so going to the next question. This is around testing, and this is coming from Bina Bendel. If they provided a chronic condition note for allergies, is there any guidance for that?
Yeah, so you want the note to be sort of as specific as possible, right? So you want them to name the symptom. So obviously if you have allergies, that doesn't mean that, all fevers are okay or all coughs are okay. So what are the student's symptoms? And is there an endpoint? Are these year-round allergies, fall allergies? So just what you're looking for is specificity. So if the note says, say congestion, and then the student develops a fever, the parent can't be like, but I have a note. Well, no, those symptoms are not named in the note. Therefore, we're going to treat that as the way that we would treat any student with symptoms.
Okay, thank you. The next question we have is from Carla. Is a point of care NAT considered a confirmatory test or only PCR?
So it depends on the situation and it depends on the test. So the state has said that if a student develops symptoms in quarantine, so this is a student with an exposure, that they need to have a PCR. And no, that student can't be in school while you're waiting for the PCR. Once they develop symptoms, they need to be at home and awaiting the results of the PCR before they can return. If that student doesn't have a known exposure, you can use a point of care NAT, but I think if you look at the footnotes, and I'm sorry about all of the footnotes in the testing document, certain tests like the Avid ID Now, we try to follow the emergency use authorization from the FDA. The state has been clear that, everyone is supposed to follow those. The Avid ID Now needs confirmation in a symptomatic student with a negative result. So, which is unfortunate because I know the Avid ID Now is a sort of popular test that a lot of schools are using. But if you have a student with symptoms who has a negative Avid, they need a confirmatory PCR. There are other point of care NATs that don't require confirmation. So it depends on the test and it depends on the situation.
Thank you, Dr.
I know, I'm
Watt.
sorry about my dog. He's a little crazy.
No worries. Just want to let everyone know, so I see I have a question in the chat or just a comment in the chat about getting to the questions. We are categorizing them. And so they are not going to be addressed in the order that we receive them, but they're going to be addressed by category so we can try to bunch them together and not hop around. So just want to let everyone know that's the process that we're using. So we'll get to it. And if not, we will definitely reply or send out any responses to questions we did not get to during this meeting. All right, so the next question comes from Sandra Hoffman-Dorrance. Could we accept a rapid molecular and allow the student to return to school while they're waiting for the confirmatory PCR? Sorry if this was addressed as I got pulled away for a minute.
I think my answer to the previous question covered that. So there are certain circumstances when you can use a point of care NAT and certain circumstances where you can't to clear students. So namely, CDPH has said that if you are in quarantine and develop symptoms, so you've had a known exposure, you need a PCR. You can't be in school while waiting for your negative PCR to come back.
Okay. This is likely related. This is coming from Miguel Reyes. If there is a positive antigen test, but later a negative PCR within 48 hours, should they be allowed back in school?
I think I answered that in the chat. Yes. So a positive antigen, negative PCR within 48 hours. Yes, you can.
Next one is from Sandra.
If they're
Hoffman.
asymptomatic, sorry.
No
They're
worries.
asymptomatic.
Okay, so from Sandra Hoffman-Dorrance, why would we accept an antigen for scenario 2 and not for scenario 1? So I believe we're talking about the testing scenarios document. Could we accept a rapid antigen for a student to return after having symptoms if there is also a lab-based PCR pending?
No, you have to wait for the PCR to come back. If it's negative, the state may change that guidance, as I mentioned earlier, within the next week, but right now you cannot use a rapid antigen to clear a symptomatic student. If it's positive, you can accept it as a positive, but if it's a negative, you need a confirmation.
Okay, the next question is from Jamie Phillips. If a student has a positive antigen test with symptoms, then gets a negative PCR, we still treat them as a positive case, correct? They shouldn't be retesting in this situation, right?
I mean, so yes, and everyone does because no one wants to be positive. So if they retest within 24 hours, within 48 hours and the PCR is negative, you can allow them to return to school.
Thank you. Okay, so the next question is about SPOT. This is from Paul Ferris. Can we get an update on the SPOT process, the contact tracing mass uploading of contacts they are working on? So any update about the mass uploads?
Yeah, that's a good question. It was supposed to be done in early October, I believe, and it's still, I don't believe, complete. So I checked in a couple weeks ago on the date. Let me check again and we'll get back to you with the actual date. They may even mention it this afternoon in the state call. I can ask on our state call with CDPH, California Department of Public Health, and I'll get you a date of when that's expected to happen. And just so everyone understands what this question is, right now, when you enter in your contacts into Spot, you can use a template, but you have to kind of access that template separately. What they're working on is for that template to be right in the system. So you can just click on it and enter your bulk upload right there. And hopefully that will happen very soon.
Okay.
I'm gonna say we have a system that we use, but something that's easier because I don't have time to. We do the contact tracing, which takes 2 to 3 hours as we do it when it hits. Thank goodness it's only. I'm at a high school that's 94% vaccinated, so it's maybe once every 3 weeks, but still it's a long time. So if we can do a bulk upload, that's going to save a lot of time for us. So thank you.
Yeah, sure. Yeah, no, I agree. And you still can you can still do a bulk upload, but it's just not as easy to get to in the system is my understanding. And Paul, if you have questions about that and kind of need support on how to do that at the moment, we have, I can connect you. If you can email Safe Learning, I'll connect you to Elaine who works with our Spot team and she can help you with that.
Okay, thank you.
Thanks, sure.
And just want to acknowledge, it looks like Elisa has an update. So Spot updated the system yesterday, template now in Cal Connect. Okay.
Good.
Thank you for that.
Nice.
Okay, so moving on to the
Alicia.
next question. And this question, I believe, is about quarantine and isolation. This is from Miguel Reyes. It says, what about parents? Had a case when parents claimed to be isolating but living in the same household. Should we follow an honor system or take precautions?
Yeah, I mean, it's hard. I mean, unless you had another adult living in the house, like grandma's living there and the parents are isolating. I mean, I think it depends if you want to get put in the position to sort of figure these out one by one, or if you just want to make a blanket rule, which will probably make your lives easier. I mean, I think it's sort of unlikely. You can see for some families, if it's a sibling, that they could potentially really fully be isolating in the house. I mean, even that's tricky, but it's hard to imagine that working for parents. So you can think about for your school, if you just want to make a rule, like if you have an ongoing household exposure, like this is the way we handle it, so that you don't feel like you have to be trying to decide, if people are being straight with you or not.
Okay. All right, so next we have a question from Holly Oberg. So to clarify, a vast majority of the time, children in a household with a positive case are looking at a long quarantine time, regardless of parents' statement of ability to isolate.
Yeah. Unfortunately, at this point, that is true.
Okay. All right, the next question comes from Kathy McCall. When a student is at home waiting for test results after having symptoms or was exposed, asking for homework for more than one day makes it obvious to the teacher that the student is having to follow COVID quarantine guidelines. I know we don't need to confirm that this is true, but parents only ask for more than 1 day's worth of missed schoolwork for 2 reasons now: an extended vacation, or they're happy to say this, and they are happy to say this, or because we have required them to quarantine. Some parents ask the teacher directly, so no confidentiality issues with that. But if the school asks the teacher on behalf of the parent, is that okay? I would imagine that if you're just asking for work and not stating why the work is needed, that you're not having any issues with confidentiality. So I don't think you can be held to any assumptions if you have not actually said specifically that you're asking for work for that student because they are in quarantine.
Ruth, I agree with that.
Okay.
I think that this is just part of the process. I think it's unavoidable that these situations are going to come up, and provided that you're not discussing the medical status of the student and you're merely discussing the, how to retrieve some of their academic work or create assignments for them, that I think that just is what it is. I think we all know where we are, but you're not, you're not discussing their status. You're not discussing a positive negative test. You're not discussing quarantine specifically, but you're keeping those conversations strictly to make up academic work. I think you're fine.
And I think, if a teacher asks you directly, you can say, oh, feel free to check in with the parent for more details and just don't. And then if I think, your counsel for your school or district is another good resource to ask confidentiality questions to.
Absolutely. Council and also your HR department, they have been having these conversations since the beginning of the pandemic as far as how to keep student confidentiality under wraps. And that's also one of the suggestions that we give you all as COVID liaisons, to have a touch point with those offices within your district or your school site. So if you haven't already had a connection with your HR department or with your legal counsel about this issue, this might be a good time to start to have that conversation so that you can provide tools for yourself or school site liaisons when this issue is coming up. Okay. So I'm not seeing any more questions that we have pulled, and also notice that we have some additional resources that are in the chat, but we also are at 10:57 and only 3 minutes before it is time to close. So first want to say thank you to our partners at Public Health. Thank you for joining, and thank you for all of the resources that you always bring along with you. Thank you to the ACOE staff for working behind the scenes to get all of this set up. Just a quick reminder for all of you COVID liaisons, this link that you are using for Zoom is the same link that we will use every month when we have our COVID liaison check-ins. Eric Sarb will be the person reaching out to you to remind you about the check-ins. And also, if you have any questions about the Zoom link, you can reach out to him and he can support you with that. And please utilize the agenda that has a ton of links to resources, including to our guidance document that has almost all of the documents we went over today. The exposure letter template is not up there yet, but as soon as we get it, it will be included in the guidance document. And as always, if you have any questions or need any additional support, please feel free to reach out to any of us, and we will try to guide you in the right direction if we don't have that support with us. All right, with that, thank you everyone, and have a great rest of your Friday.
Thank you.
Everyone, have a good weekend. Thanks, Ruth.
Thank you.